3, 2, 1.
There, we're on. Hello, everyone. Welcome to our webinar today. We are here with Dr. Celine and Rebecca Rose, our VT. We're here to talk about enhancing your communication skills during the most sensitive time for pet owners, which is humane euthanasia. So I think we're going to do a little bit of a round robin and have everyone introduce themselves. I myself am Heather Ashcroft. I take care of the community at Digitail, and I have a 20-year history in vet med working at general practice, specialty, emerge, and shelter medicine. So I have been on both sides of the table when it comes to euthanasia, and this is a subject that is near and dear to my heart. It's something that I always would pride myself in being able to have effective communication with the pet parents, and this is something that I'm really excited to share with everyone here and to talk to you ladies about. Rebecca, did you want to go first?
That'll be great. Thank you. And thank you for inviting me and having me. In my experience and my career, it's been quite long and diverse within the veterinary community. I've been credentialed as a technician since 1987, so y'all can do the math. It's a long time, a lot of fingers, a lot of toes. Thank you, because that's very rarely does anybody have that long history in our young profession. During that period of time, I've literally done pretty much everything there is as a veterinary technician. I was most recently appointed by the governor of Colorado to be one of the first registered veterinary technician members on the state board. So I'm very proud of that.
Wow.
Last year I became, thank you. That's a big deal.
It is. Congratulations.
Thanks. Last year I became a certified peaceful euthanasia professional through CADA, which we'll talk a little bit about that and how other folks can become that. I became a certified career coach in 2019 because I literally physically wrote the book on career choices for veterinary technicians, and it's been published a couple of times. I've managed practices. I'm a Nana. Yeah. So I love my career, and I still don't see a glass ceiling to it. And as Heather was talking about how, as a veterinary technician, even on the floor in the 80s and 90s, I too felt it was important to help those pet parents and families, especially those with children, in having peaceful euthanasias. So this has been a part of my career for a long, long time. So I'll hand it over to Dr. Celine.
Hey, I just did the math, and we accumulate, I think, about over 80 years of experience on the floor, ladies.
Nice.
So 25 years in practice, and I studied in Quebec, and I'm from Quebec, and now I live in France. And it was my childhood dream to be a vet. And when I was thrown in practice without any education around end of life, I really learned the hard way. And for me, it was my child's dream, the most beautiful job I could do on earth, but it was so tough. And I broke my nose so many times performing euthanasia without any training. And at the end, I was doing everything I could to make that experience better for the families. And then I needed to put beloved pets in a garbage bag. And I'm like, man, this is my child dream. And I feel I'm working in the mafia. Like, I didn't do well at school, and I just had to go walk in the streets and find something to do. I just felt like this is not aligned with my dream. And I think we're the best people on earth and performing such good medicine for the price it's costing. So anyways, I looked for an option, couldn't find anything. I'm like, okay, no, there must be something wrong. There must be a body bag in Japan or Italy or somewhere. And then after the clinic, I would go home and look for it, couldn't find anything. I'm like, okay, well, I'll just design it and market it. I'm a vet. Let's just read the book and figure out how to do things. So that's what I've been doing since 2016, providing a designated body bag aligned with the bond that we share with our pets. And a fun way to market it has been through education, just because we're all brothers and sisters in the vet space. And I don't understand why we throw our young vets and veterinary technicians in the reality without training them more than I was, zero training 20 years ago. So yeah, this is my passion, and I did not believe that I would be so passionate after 8 years of just looking into end of life every day. I still learn every day. You know what I mean, Rebecca? It's just crazy.
Yeah,
And I feel now it's the space where I can make a world of difference. Versus an internal medicine or cardiology consultation. I'm not the best on the planet. And, many people can do a better job. But at end of life, I'm just passionate about sharing that and making a difference.
Yeah, that's great. I just want to acknowledge the fact that both of you ladies were kind of trailblazers and carved your own path, and have kind of made your own way in your careers, and you're both very passionate, and it's important to follow your passion because that's what makes you good at what you do. So thank you guys for being here. I'm gonna get this guy down. He's distracting me. So I just wanted to acknowledge the fact that a pretty shocking statistic is that 20% of pet owners end up seeking out a new veterinary clinic post the euthanasia experience, and kind of unpacking the reasons why. We've got a lot of information to kind of go over. We're going to discuss what exactly we can do to elevate our communication and how to put that into practice. But I think we've got a list of questions that we can go through to kind of direct the conversation. But I think the beginning with the communication journey is really how can we prepare pet parents for the euthanasia process in a clear yet a compassionate manner?
So just to circle back on the statistic that's been going around for a while, 20%, and we don't know that, we don't feel that because we help them say goodbye, and then we don't know if they're gonna have a new pet. A lot of them will say, it's my last pet, it hurts too much, so you lose track of them, right? And in my own experience, I believe as I grow older and have all of those experiences, it makes me a better vet. But then when I lost my father, and I was there when he passed, and he waited for me, he was in a coma, and then I showed up. I thought he was going to be unconscious, and then he heard my voice and just kind of woke up. It was a crazy experience. Wow. I said goodbye to my father in a specific room in a specific hospital, and then I had a newborn. My daughter was a couple of months old, and then I started thinking, what if I have to go back to this exact same room in that exact same hospital and get my daughter vaccinated? I'm like, it's never going to happen. So now I understand why people just don't want to come back. And that 20%, Heather, it's no matter how much they love you. No matter how much they think you're the best veterinary professional, they love you. We know those clients, and we just love them. But yet we lose them just because it hurts too much. And all what we are going to talk about is how to retain them and show them how much we care. And they're like, oh my God, I got to do this and go back to this exact same room because they're just the best team I can find for my baby. And so there's another stat about that published by AHA. And if there's anything that the client thought was not optimal, their baby screamed when you gave the sedation or anything like that, then it's 40%. Almost half of them won't come back. Wow. Anyways, how to ease that? Personally, if you wanted me to continue,
we've got lots of questions. Tools. Yeah, for sure. I think what we'll do is we'll go kind of back and forth because I want to hear what Rebecca has to say as well. The statistic I'm sure you're familiar with. What do you think affects that? That was a really good personal story, Celine, of exactly that, of not being able to return to that space, right? It's very triggering. What do you think?
Well, as we know, veterinary medicine is much different than all other professionals in the human space. And as Celine suggested, we see them from the time that pet walks in the door as a puppy or a kitten or a gerbil, whatever that is, until the end. So there's this beautiful time that we have with them. And to the point is that when that euthanasia is relevant and that time has come, it's important for our teams to understand how do we express to that family that it is time. And so even I'm all about training. So you guys are going to hear a lot about training of that team. I'm going to be putting on my practice manager hat as to how can you do that. And during team meetings, just setting aside time that says, how can we help our pet parents understand when it is time for that fur baby to let go and get its wings. So formal training of our team collectively is important. Those team meetings, opening up for open dialogue, what's going well, what can we do better, but setting aside time for training and when is it time and how do the receptionists understand to have that conversation on the phone? How do they have that conversation in print because we're emailing and texting? It's really difficult to convey compassion in that space. And yet we need to, from the very beginning, setting them and priming for that loss and all that follows, the aftercare, everything.
I think one thing that has been really helpful, so again, because I've been in practice for quite a while, not as long as you guys, but one thing that's really helpful is the BEAP pain scale. And there's lots of quality of life calculators and forms and things. And I even had
apps even.
Yes,
No.
yeah, exactly. And we were talking before about my most recent experience euthanizing my senior cat in my home, and my vet, who is a friend of mine as well. She sent me this questionnaire to fill out, which is great. I love having tangible things. I love having things to read over. But for me, what I kind of felt was that this might be a tool that kind of takes that empathy out of the equation, where instead of having that conversation with the pet parent, you're just kind of like, oh, here, this is how you'll tell, right? Where for me personally, I always get more out of an actual conversation, having that human interaction rather than just kind of being sent home with a piece of paper.
Yeah, if I can mention something here, I agree with you, but what I was facing in practice often is that the lady comes with her animal, and then we're facing that decision in the next couple of months, and then you're like, yeah, you have to start thinking about it, making the choices, getting informed and everything, and then you have this conversation, and then she will go back home and her husband will say, so what did the vet say? Well, we have to start thinking about it. Yeah. Okay. So it's one of the hardest decisions people face. And so I believe that, yes, the handout is just one tool, but then it opens the discussion, and day to day they can. So I'm a big fan of the questionnaires or the apps or just something like, because people don't know how to judge. They don't know the body language of their pet. They don't know what it means. What they will say is, well, he doesn't cry, he's not in pain. And they don't know that the breathing means that they could be in pain. They don't know that the hygiene has something to do with the pain and the quality of life. So I think it's one tool, and then potentially they can have a discussion in a family space, because these guys have big fans, and so I think it's good. And then they come back to you and they're like, yeah, we talked about it, and then it opens, I find, the conversation. And for some people love the app, some people like the paper, some people like the calendar, but I find that we have to find something, at least offer one thing that they can just grab on to.
And not lose that conversation, right? Instead of, like you're saying, here's the app, here's the piece of paper, fill out the questionnaire, and it's reminding us as veterinary professionals, whomever we choose on the team, to follow up. And if you happen to have a veterinary team member, because that was me so many years ago, and in now today too, even, that I'm the one that wants to be on that conversation. I'm the one that has that ability to speak with them and has the time too. This doesn't necessarily have to be a veterinarian-led conversation.
No, exactly.
This could be an assistant, a technician, even a receptionist that really is ready and willing to embrace this conversation and take the time to do it, because it's just not a boom, 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 let's check the boxes. No, this is a much more compassionate, heartfelt conversation. And if you have team members that are good at it, embrace them and support them in becoming even better.
Yeah, they usually find it very fulfilling. And I'm a big pro of quality of life appointments. I think we don't offer them enough. And as you mentioned that, Heather, and that it really resonates with me. You need that conversation. But then often they would come to me and I say, well, it's about time, but we would not follow up. Like I should have put a follow-up planned in the schedule, call them back in 2 weeks or in a month, which we were not doing. So that could be an easy way to follow up with these guys, because they might be just ashamed of calling us back. They feel guilty. And that's the big thing to, to fight, is all that guilt around that decision, right?
I think that's the main thing too, is that they as pet parents, you don't necessarily know what to watch for. So these handouts are great, but again, pairing them with that care, right? They want to be able to speak to someone. Oftentimes, losing a pet isn't really understood outside of that relationship, right? It's huge. It can be even more meaningful than losing a family member, because they can be that integral to your emotional well-being. So you have to treat it with the respect and the gravity that it has, right?
Yeah, and around those people, it's very polarized. Around them, they have people say, yeah, just, put him to sleep, stop it. And the other one's like, oh, you're not going to do that. And then they're just very lost, right? They need us to...
Yeah, and I think that the next question that I've got here is kind of ties into what I want to mention, which is that we can't be making assumptions about the people's relationship with that pet or their cultural or religious beliefs also. So I think the question here is, what are some effective ways that we can discuss the decision for euthanasia without inducing that guilt or regret in pet parents, while being respectful of that?
Go ahead, Rebecca. I'm sure you have a lot to say.
Yeah. Well, let's first talk about that value, because prior to us going live, I was talking about how I was giving a class not too long ago, and we were talking about the moral value of those pets. And I have a colony of feral cats on my farm, and they all have names, and they all get special treats, and I just love each and every one of them. One's very much no longer feral, but he's outside and he cuddles up with me, and I love him. And I mentioned that when that time comes, I'm going to have a veterinarian come to my house and euthanize my feral cats, because they need to have that service as well. And I was all stunned by the reactions I got from the people in the class, like, you are that crazy cat lady. And I was, it's unfortunate that I think our teams do that as well in their body language. They want to be expressing empathy and compassion and all that, but their body language says, you are crazy. But coming back to the question, which was, forgive me, I forgot what the question was.
It was, what are some effective ways to discuss the decision for euthanasia without inducing guilt or regret in pet parents, while being respectful of their religious or cultural beliefs?
Yes, so it's just allowing for and putting that team member that has this opportunity to have those kind of conversations and open up prompt with open-ended questions. How do you see this service with you and your pet? How can we support you in what you need or want? What do you want to see in this service? And those are questions that people usually do not have in their toolbox. So giving those team members those open-ended questions in, what is it that you want? So I'll send that over to Celine at that point.
Yeah, well, I was just going to say that, actually. I think the best way to take all of those considerations in account, their life experience, their religion, everything, is just to ask them if they would be in their pet's position, what would they want them to do, for them. And making that decision takes so much courage. And by putting an end on that pet's suffering or loss of quality of life, they're actually starting their own pain, right? So this is why it's so delicate. And it's the best, proof of love, when you're able to say, I'll make you stop your suffering and start mine, start ours. And there is a very powerful poem out there that it was written by an anonymous author, and it's available everywhere. It's called If It Should Be. And, it's about if we cannot do anything about my condition anymore, will you be there? Will you make that decision for me? Don't feel guilty. I know this is hard for you, da, 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 da. And it's just so powerful. When I found that about 20 years ago, somewhere on a desk, and read it, and every time I read it, I get emotional. And so I've included it in all my end of life euthanasia appointments, and I've had so many good feedback from pet owners saying thank you, because of that text that is yet so simple, I did not postpone the decision as I would have maybe 2 weeks. Imagine 2 weeks. It's big, So, and then they remember that you brought them that poem, and to just remove that guilt, and also include yourself in the decision. Often, or I used to say that for many years, you're making the right decision, or you have to make the decision for her. But now I'm like, we're making the right decision for her today. You as the family, the pet owner, and me as a professional, I have a certain distance, I have a knowledge, and I think this is what we should do. So just instead of, being, oh, it's not my decision, it's yours, and I'm just going to kill it. We're doing this together for him or her. And
Yeah.
Yeah.
I'd like to add to that too about this piece of a partnership, because I want to look at it from a team perspective as well. So asking that team, during that, prompting them for a team meeting, hey guys, the next team meeting, bring all of the poems that you have had or held or been sent over the years, and let us identify 1 or 2 or 3 that we feel really resonate and align with who we are and the services we want to provide. As you can tell, I knew I was going to lean on team training, but it really is a team effort from the time that they pick up that phone to the time, or even what that website looks like. But when they choose those poems or even handouts that they know why they've chosen that handout together, that's powerful. And that really builds that partnership from beginning to the end.
Mm-hmm. Agreed. And I think that even those handouts, or even the bereavement support after, I think as much as, before I said, I don't just want to walk away with a piece of paper, but after a euthanasia, leaving empty-handed is so hard. And having something to even just a piece of comfort, like you said, like the poems are great. Obviously, they always hit home. But then having some resources, like, if you're really struggling with this loss, directions to go. Is there a support group? Is there something online? Is there some additional education that I can get about this emotional process that you're kind of working through, right? I think that's really important too.
Mm-hmm.
And we're very well placed as veterinary teams. And sometimes we just forget to talk about that part. But then who else is going to take over? Not their family, not their friends, not their work partners. So it's really just opening the door to say, there are some resources. And actually, I have a story myself. Like, I had a client, she had the best medical care ever for her pet. And I just saw her. I knew she had lost her pet at a referral center. And then I just saw her in the street, and I'm like, oh, hello, you lost him. How are you doing? And I could feel she wasn't right. She was not on the path of a normal grief. And I'm like, oh, did you know there's a pet loss counselor service that you can reach out? And they, it's usually 1 or 2 1-hour consultation. It costs about $100, and that would really help you. And she went, no, I know. I had no idea. I went to my psychologist, and he wanted to fix my problems with my father. And she's like, no, I just lost my pet, and I did everything, and I spent so much money, and I woke up at night, and yet he died, and da-da-da. I'm like, yeah, I know, it's so hard. She reached out, and then she came back to me. She's like, oh, thank you so much. I had no idea. And she got the best medical care ever, but nobody thought about telling her that at the referral center. And so I'm like the JP, I don't know how to do all the care they did, but I brought so much value. Like, she remembers me because I just said that. So her name is that. Google her up and book and consult with her. And we could even include, for those really, really good clients that we feel we could just offer it. And, not a lot of them will take it, but imagine the value and the loyalty of these clients and the feeling that we have that we made a difference. I made such a huge difference in her life.
Definitely. Even just this past weekend, I was at ABA and, oh, sorry, Rebecca, go ahead.
I have comments about that, because I think we need to include our veterinary teams in the feeling that we have too for these patients, because we've cared for them, as I mentioned before, sometimes when they were a puppy or a kitten or even a gerbil up. And so for our veterinary team members, we need to know too that we have opportunities to have Facebook groups or therapists, or this is not something that we found, but allow for the health and well-being of our veterinary teams, because we too love these. And even for clients that we feel through this before, we don't give them those, or they have the anticipatory grief or what that is. I still suggest we give everybody, all clients that are going through this, because they may have a young child now. This might be a different place in their life, right? As the more stoic of me when I was in my 20s and 30s is not the emotional person I am in my 50s and 60s. So I think we need to give them something for who they are now, not who they are.
Yeah, exactly. I was just saying, this weekend at the AVMA conference, I met with, it was actually a husband of a vet, and he used to work in hospice. And we got talking about the euthanasia process and kind of the differences between human hospice care and animal hospice care. And one of his goals when his wife was opening a new practice was that he was very supportive. He wanted to be very involved in the clients and like be involved in the relationships and be the person that maybe after that euthanasia, he's like, I got the time. I know the things to say. I can call them up and say, how are you doing? How have things been? And I think that's a huge piece of this puzzle, this retention puzzle too, is like Celine was saying, you have those quality of life visits, that the inevitable is coming. You've sent them home with this information, but just that little bit of follow-up, just that continuing of that relationship with them, it shows them that they're important. It really validates their love for their pet and the difficulty with making this decision.
Yeah. And I love I wrote it down, the retention puzzle. You're right. It's just so many little things that you have to put together. And excuse me, I wanted to just share the fact that, it's the least thing you want to do after euthanasia. But the couple of times I did it, when I called the owners about 3 days after, and then you're like, oh my God, they're going to talk to me about, how he used to be and what he used to eat and all these, as they go on, when they talk about their pets, sometimes it takes a long time and you're afraid to call them. You're afraid of their reaction and everything. But the times I did it, it was so fulfilling, because they were just like, oh, thank you so much. Yeah, I'm fine. It's hard, but thank you so much for making the time and 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 then they give you feedback on their experience. Because if you don't call them, you don't know. Their perception is so altered by the emotions that something they might perceive it went bad and it wasn't. It was because, they heard another pet scream and they thought it was theirs because you went in the back and put the catheter or something like that, And then you're like, oh, no, it wasn't him. Oh, I'm glad we talk about it. And it's, in my experience, it was less than 3 minutes. And then I think it was really a good investment in returning them and making sure that there was no things that were misunderstood.
Mm-hmm.
And again, it doesn't have to be me, the vet. It can be anybody on the team, right?
Yeah. And words do matter, Celine, right? I think about that time when, and this might hit a chord on some of the people that are watching this, but the receptionist has no other tool in their toolbox, and they don't understand maybe what the service was that was performed, and the family is leaving, whether they were unable to exit from the back or the front or anything, and they just roll off their top of 10 is, hope you have a great day, or something along those lines, right? So being able to give our team members more words that, instead of just always signing, sorry for your loss. Well, what is another phrase we could be using? And I was definitely that technician that said, no other tools in my toolbox. Well, at least you had 15 years with them, thinking that was a beautiful, wonderful statement. Well,
yeah, me too.
Actuality, and I want 15 more. And I thought I was being kind.
Me too. I thought it was great.
That was when
I thought it was very compassionate.
But there's so many other things. Yeah, but no, I've learned that no, it's not. And like I said, there might be people saying, oh yeah, I'm that person, regardless of the position. But giving our teams more tools in their toolbox, more words to say, in that the time that you had with them was so precious. Period.
Yeah, and just switching from, oh, you had 15 years, you can just say, I know it would never be enough. They never live long enough. I would bring him to live 30 years, it would still not be enough, right? Just switching to that makes a difference. So, but yes, words matter. I so agree with that. But in the vet space, we are so perfectionist that I find that we're so afraid of not saying the right words. But a lot of our communication is nonverbal.
Mm-hmm.
So I think if we're just like calm down on, if my nonverbal is fine, probably what's going to come out of my mouth is going to be as well. And 80% of the communication is nonverbal. So if you're not looking at the people, whatever you say, you don't have an eye contact with them. Well, it's not going to go through, right? Whatever the good words you're saying, if you just say something that is less agile or appropriate, well, if you're just looking and they're seeing in your face that you care, then the outcome is going to be just as good.
Mm-hmm.
Yeah. And yeah, can I say a word on the nonverbal?
Yeah, absolutely. Yeah, it was something that I wanted to get into because I want to talk about preparing the space and also, the body language. One thing before we get into that is just with the team communication. I think that it's really key that when you have a euthanasia happening, that there is some communication in the hospital, whether that's through your software or just a quick word between the team members, because obviously you want to be sensitive to what that person is going through. But you don't want to be the person at the front desk saying, have a great day, or greeting them with like, oh, so glad to see, Fluffy, and that kind of thing. And so that they can all be kind of on the same page. And then also to be sensitive, because some team members might be attached to this pet as well. They might value that, be the opportunity to greet that patient and that pet parent and express their sympathy. Sign that card with that poem, something like that. But yeah, go ahead. But there's some questions about the poem, so we'll get the reference to the poem. We'll put that out there for them. And then, yeah, let's talk about preparing the space and body language, because I think those are two really important pieces that we want to touch on. So go ahead, Celine, and then we'll talk to Rebecca.
Yeah, that's just again, I was thrown in practice without any training. And then, so I was feeling responsible for their pain and their grief and everything. Whenever somebody feels bad, I feel it's my fault or I need to fix them, right? That's pretty typical in our field. And then so they were showing so much pain and distress that I would tense up and feel bad and start looking on the floor. That's a natural, reaction. Then I met somebody that had lost her husband. She had 7 kids, and I just happened to meet her. And I'm like, oh, it must be nice because everybody around you are surrounding you. They're present because they know you're facing this. And they're like, oh no. She's like, it's the opposite. Everybody just flew away because they're so afraid to talk to me. And I'm going to tell them all about my life. But I just want people to ask me normal questions and treat me normal because I'm going through that stuff. Mm-hmm. I'm like, oh, okay. So I just thought, oh, I will try that in the euthanasia room. And instead of being, I'm sorry. And like I thought that it was nice. It was good for me to look like sad. But again, it was a bad idea. If they feel guilty, they walk into the room. They're like, oh my God, I'm coming to kill my best friend. I'm coming here to kill my baby. And maybe they could save it. And then they all have all these questions. And then the doctor's like, like that, all tensed up, not looking at them. They're like, oh my God, he doesn't agree with the situation either. So it's making it worse. So then I just started just trying to be natural and sharing my story and going like, I know today it's not easy. Like it's such a tough thing, a tough decision to make and a moment to be here, but we'll do everything we can. But just like trying to share my story and making it look legit that I agreed with them and I was there present with them, and I'm not responsible for what they feel, but I'm just here to be supportive. And for me, it was such a game changer just to try to stay normal, breathe deeply. And that was also calming them to see me that calm. They're like, oh, the doctor is in control. She's calm. She's okay with it. She's looking at me. Okay. So that's what I wanted to share about the nonverbal. It's super simple, but for me, it worked.
Yeah. Confidence. Absolutely. Being able to show and express confidence and control during this tough time, seeing what they're seeing, being empathetic to what that looks like, what they are. Maybe they're frustrated, maybe they're guilty. I can see whatever that reflection is. And again, not having to fix it, just judging it, right? And see,
acknowledging
sometimes there's a lot of anger, the guilt, and coming back to that confidence and control for anybody that's helping with that. And the emotional intelligence piece is what we're talking about, self-awareness. So Celine, you talked about how am I expressing myself, self-aware about that. Emotional intelligence is a big thing. It's self-awareness of who I am and what I'm bringing to the table in this moment. And maybe some of the baggage I have, even maybe this pet looks like an old pet of one of my beloved pets, or maybe this is the anniversary of one of my beloved pets, right? So how do I package that and be aware of that? And then the awareness of what the family and the client is going through, and the awareness too of the pet. That's a lot of emotional intelligence to be wrapped around in a short period of time as you walk into that exam room, or you walk into that home for an in-home euthanasia. So one of my notes was here, that's just a lot of EI. And we don't teach EI formally anywhere for the most part. We do within our CADA instructions, but that's rarely something that anybody talks about.
Mm-hmm. And I think that I read something actually recently that the majority of people in vet med are really not people. Like, they're not socially skilled. It's not something that comes innately to us, right? We're in this industry because we love animals. We want to care for animals, but navigating that emotional intelligence can be quite difficult. And I think it's something that's important not only for the clients, the pet parents, and that process that they're going through, but also for us personally, because in my experience, I was kind of surprised at how intense my own feelings could be at these euthanasias, where these patients that I had seen grow up, that I had really gotten to know their pet parents. And I think that really being able to communicate effectively, not only with the pet parents, but internally with ourselves, is so important. One of the questions that we have on here is, what are the most important aspects to communicate about the pet's comfort and the humane nature, of euthanasia? And I think this kind of ties into the Euthanese that Dr. Celine had been, I guess, the inventor, the founder of this term, which I think is...
Yeah, I actually came up with that during a webinar. That's from, I'll find it. It's somebody else. It's not my expression, but yeah, I adopted it. Yeah, the Euthanese.
Mm-hmm. Yeah, and just and saying something as simple as, instead of like something second nature to us, is like, okay, we're going to go and put the catheter in, and that doesn't mean anything to a pet parent, right? There's other terms that we can be using. Other, when we talk about the aftercare, there's a lot of like buzzwords in the industry that mean nothing to pet parents, and it's really important to be on a level playing field with them, be able to speak in layman's terms in order to get that effective communication and empathy across.
Yeah, because we forget that we speak our own language. We forget that we speak a jargon and nobody else understands. And so that sometimes it's also good to just take a moment and remember when you did not know what you now know. It's just, it's an exercise. It takes some energy to do that. But yeah, that actually I learned from Danny McVitie, that created Lap of Love. And it was such a game changer. And it took me like 15 years to come across that. And so, yeah, as you said, I used to say, so first we're going to put an IV catheter. And I thought then, because I was young, I thought, they're not asking questions, so they must be understanding what I'm saying, because they didn't ask. But no, they don't ask because they're afraid to look stupid, and they're afraid to be judged. They're looking for a permission from us, saying, it's okay. It's an act of love. It's an act of courage to be here with your pet. So yeah, instead of saying the IV catheter, you can say, well, we're going to put the device in his vein, just like when you go to the hospital to get some fluids. It's going to be the same thing, so we can access. You might not be putting a catheter, it's fine. But don't say just a catheter thinking they're going to understand. Or I often hear, we're going to give it a sedative. A sedative. What's a sedative? It's a calming agent. We're going to give him something to feel relaxed, get the pain removed. And just put him in a very good state, and he's going to be feeling much better than he's been in a long time, because he's not going to be feeling any pain, and he might fall asleep, and he might pass in his sleep. And often I used to say to, we're going to just then inject a euthanasia solution. Euthanasia solution, what does that mean? And it's not a euthanasia solution that we're using. It's a large dose of anesthetic. We used to use this as an anesthetic. Doesn't that feel much nicer than an euthanasia solution? So it's just super simple, but of high value. And then something else I used to say is, or I hear all the time, you'll know when the moment comes. You won't, like, nobody knows. That's why they wait so long for a lot of time. And just instead of that, saying it's extremely difficult to decide when. So things like that. And also Rebecca, referring to what you said before, I used to say that all the time. You can't do anything for him anymore. You can't do anything for him anymore. It's so depressing.
Yeah.
Instead, you can say, you've done such an extraordinary job. I wish I'd be your dog. Like, you're the best pet owner. You did everything. But now at this point, we just got to let him go. We just got to think about him first. And we did everything. We did our job. But now we have to just take a step back. Yeah, I'm sure you have other examples, ladies.
Mm-hmm. Yeah, I'd love to hear what you've got, Rebecca, if you have any specific terminology or any experience that you want to recount that we can learn from.
Gosh, I really want to kind of lean on helping our team members understand their own emotions in this. And to Heather's point earlier, that our social skills are constantly growing and changing and morphing. Even now, I still am a lifelong learner in social skills and what to say and what not to say. And I still screw up all the time. But I think really giving our teams at this vulnerable point in time, with them being vulnerable and expressing empathy and compassion at a different level than they've probably been asked for before or been formally trained in doing, helping our teams express their own feelings. I'm anxious too about this, maybe this one case, right? Maybe I've never had a case that came in that is so depressed that is going to have lack of perfusion all over its body. And how am I going to euthanize eloquently in that? We were discussing about the how to phrase the service that we're providing. I think we want to over verbalize it. I think we want to express things that don't need to be expressed. Think about when our clients are in the room other than maybe the times that we're diagnosing a diabetic cat, how frequently are we talking about a medical procedure with our clients? I think we just really have to be cognizant of gentle words that are not medical, that are from the heart, not the head. We want to embrace all of our medical terminology. And this is probably that one and most specific time to take medical terminology out of the equation. And to your point, it's very difficult. Not unless we have a group conversation with our team. How are we going to do that for everybody? So it's a conversation in heart language versus head medical language.
Mm-hmm. And I think that the challenge with that too is sometimes taking yourself out of the equation. If you are, really attached, and it's okay to show that and to be empathetic, but you really have to try to focus on making the experience the best that you can for obviously the pet parent, but also the pet as well. And what would you say, Rebecca, is the most important thing to convey, during the process? I know that Celine, you had said about explaining in those layman's terms about what's actually happening. What about, aftercare? I think discussing aftercare sometimes can be very difficult, even calling it aftercare, right? That's the old vet tech in me that just, that's what we call it. But it's really, respectfully handling the remains of the pet and how to kind of navigate that conversation, because it can be quite difficult.
Yeah, and I think as much as we can, like we usually keep it for the end, you know, the very last thing, because we don't want to talk about that. But studies show that now people want to hear about it. Number one, they want to hear it from the vet team. This is who they want to, you know, they don't want to watch it on TV. They don't want to listen to it at a podcast or a website. They want the information to be from the veterinary professionals. Number one, why are we keeping it for the last visit? It's ridiculous. We keep, because when you, referring back to your last question, how do we make that easier? Well, we need to map the experience. We need to explain in detail what's going to happen, because again, we don't remember when we didn't know what we know, what it looked like, because we're so, you know, sedation, cat sedation, you inject him, 2 minutes later he's on his side watching. Like, imagine if you've never seen this in your life and it's your own cat and you were not told that within a couple of minutes he's not going to be himself anymore. You know, he's gonna that. Whoa, that's major. I would say this is like super important to mention. So yeah, just mapping the experiences is it takes some time, but it's important to say they might react, what it's going to look like, what it's going to feel, that and so on. But to go back to your aftercare, I think we can send them to the crematorium or aquamation or whatever aftercare provider you're working with way before. I know this is not easy. You might not want to hear about this, but I would like to give you the opportunity to plan this and make some choices in the comfort of your home, and give you the gift of time. Because how many times did I have to have clients make their choice at the front desk with people behind, you know, with a bag of cat food? I mean, come on, this is ridiculous. And now what I do too, when it's an emergency and it was not planned, I used to rush and I'm like, do you want a golden plate or a silver plate? I mean, that was so ridiculous. I'm like, okay, you know, we'll put it on hold and somebody will get back to you in 3 days so you can make your choices. But for so many times, yeah, I just didn't know that. So the aftercare, there's so many, it's a once in a lifetime choices. And if you told them, you know, do you want the ashes back or not the ashes back? It's way more than that. Like the whole aftercare conversation can be a whole consultation just about that. So if you don't have the time, send them to the specialist, send them to the aftercare. They're waiting for the phone to ring.
Or even, like you said, like dealing with it ahead of time, because I think these conversations bear repeating, and something that you think you might want in the moment might change after you leave the office.
Exactly. And a couple of days later.
Yeah, exactly. Rebecca, you had something to say. I want to hear that too.
Yeah. So when we got that series of questions, my point right there was receptionist training around that aftercare, because to everybody's point, you don't want that to be the conversation at the end of that service. It's something that we want them to think about ahead of time. There's so many opportunities in memorialization. There's so many opportunities in what do they choose? And it comes back to, what do they want this service to look like? What special events this can be from the beginning to the end. And receptionists are picking up that phone. Our CSRs, our customer service representatives, are picking up that phone and having that conversation frequently. These are not all of these conversations are not always in the exam room. So I want to recognize that receptionists too benefit from all of this training that is available to them.
Yeah. I would say too, if like being in the position that I was at, this was always something that I was really passionate about, and I would pride myself in it. And I thought I did a really good job. And I used to take in newer employees, newer staff, newer team members, so that they could be there to help. You know, they bring in the box of Kleenex when I come in and I'm talking about these options, just so that they could hear kind of how I spoke about it, kind of what my body language was when I was speaking about it, and the options that I gave. Because I think really our role in this is to just provide options, right? Is to tell people what are the possibilities to memorialize their pet. And then also, I think it's really important too, as veterinary team members, to remember to keep an open mind, because this is not your pet and these are not your beliefs. And they may want to choose something that doesn't align with what we think is right as a worker in the industry. And that is also okay, right? Being okay with that.
And not showing that expression like, Okay.
Yes, exactly. Yeah.
Yeah, that they will remember. You didn't said anything. You didn't said anything, but they'll remember that.
And that still comes
Yeah.
across the phone too. Like, really? Okay. Okay.
Yeah, just take yourself out of it. Like you said, ask the open-ended questions, right? We're questioning, we're curious, we're really there to help. We're not making assumptions. We're not saying, these are your options, but this is the one that everyone else chooses, so it's the right one, you know?
Mm-hmm.
Yeah, and about aftercare, I just want to quickly mention that there's still a nonsense. There is one nonsense left in vet med, I find, and it's leaving the pet parents leave with their pet full of pentobarbital to a home burial without any handouts. I've heard so many horror stories. The last one I've heard is the neighbor's cat came and dug up the family dog and ate part of the dog, passed out, went to the clinic unconscious. How can we expect families to understand it's a biohazard? It
They would
could
have
kill
no way to
somebody
know.
else. Like, so, make sure you give them a handout and make sure you ask them, where are you going to bury him? How are you going to do it? How deep? How far? Are you sure you want to do that? And in my case, they were like, oh, 9 out of 10, they're like, oh, I didn't know what I was going to do. One of my clients wanted to bury it in a sand pit. I'm like, oh, no, you don't do that. You'll find him on the side of the road tomorrow. Like, imagine the value of taking 2 minutes. Like, where are you going to, it made
they would never know. They would never think about it. There's one question that just came up from Courtney. It says, do you have any advice on how to prepare clients for things like the possibility of agonal breathing or the loss of control of the bowels or bladder?
Dr. Celine, that one's all for you.
Yeah, it's touchy, isn't it? Yeah, I think I will address them as they come. Otherwise, you already have to prepare them for so much. Plus, agonal breathing, I don't see that anymore since I use deep sedation. But prior, I don't see any muscle twitching anymore either. What I feel you really have to tell them, because otherwise they all wonder, like, the eyes will stay open. Otherwise, like, oh god, the eyes are, and then, like, I said it like 4,000 times, and the only time I don't say it, they go like, oh, how come the eyes stay open? So yeah, that's the only thing personally I think we have to say. And the rest, well, if they're doing agonal breathing, oh, it's a spasm of his diaphragm and the twitching, I say, well, it's the electricity of his body. It's all like shutting down at different speed in his body. You'll find something. But yeah, otherwise, I think it can be stressful if you say that to them prior.
Yep.
Yeah.
So
even myself.
This is the releasing.
Yeah, the release.
This is the releasing of energy, but giving again the tools for people's toolbox to be able to have when that happens. For them not to have their own freak out as a veterinary team member, but to say, these are some of the statements that work for us.
And what were you saying, Heather, about your experience?
Oh, I was going to say, even myself, like I said, my most recent loss, we had a newer vet that I didn't know come to the house and to do the euthanasia, and she, not knowing me, ran through the whole gamut of things, and it was a little off-putting, even though, like, I know all of these things. I know all these things can happen. I've seen most of them, but to have her just sit there kind of like rhyming off all of the things that could possibly happen was a little bit like, I don't love that. So I like that idea. There's got to be a balance between the two, right? And I think I just want to touch on the preparing of the space, because, like, as you said, sometimes they can associate the surroundings, this specific exam room, with this loss, with these unhappy memories. And I know that, clinics that I've previously been at, the shelter that I worked where we did a lot of low-cost compassionate euthanasias, we, tried to set the tone in the room as much as possible, lower lighting, maybe some soft music, obviously Kleenex, we had a beautiful lamp and a nice mural with like an inspirational saying, that kind of thing, which is great if you have, an extra exam room, but it's not always possible. So do you think that there's some tips that you can share about preparing the space, and even indicating in that client's record, that this is the room that they, euthanize their pet in? Maybe don't put them in that when they come in with their new puppy.
Yeah, or at least if they come in, tell them it might not be easy for you to come back to this room and like address that. Otherwise, they feel stupid. I'm like, oh, I'm the only one feeling like that. I'm stupid. But no, it's normal to feel like that. Personally, I just feel like getting just one fluffy carpet and an LED lamp that you can just turn on, and have like a plastic fern, like a plastic plant that you can just put in the room to make it, give it a different vibe. I think that can be helpful. But yeah, when you don't have and it was my situation for years, for almost 20 years, I didn't have just a room for euthanasia, a comfort room. Any tips on your side?
I have
And it
always
offered
had the
them a lot of
opportunity.
treats too, right? Sometimes having just a dish
Treats.
full of food, or and that takes their attention to this, and they can't believe that you provided this. It was such a nice thought, and distract their attention to that.
Yeah. I've had the opportunity to walk into hundreds of veterinary hospitals over the years. And when I would do outreach for Lap of Love, I'd walk into veterinary hospitals, and it was always such touching that people would actually say, I want to show you our comfort room, because people are really actually very proud of their comfort rooms. And you saw some of the most beautiful, and everybody did what they could with the time and energy and the resources that they had. But those that had comfort rooms, and if there's people who are watching this that don't have comfort rooms, I'm sure that in the resources there might be more suggestions for comfort rooms. But there's just so many things you can do that's low, that doesn't have to break the bank by any means. Definitely chocolate treats and those things that those pets have never had before is very important. So even letting the team participate in how can we make this more comfortable can be a good opportunity.
Yeah, I'm sure you guys know the clinics that have the kiss goodbyes, the little like Hershey's kisses that they give out to the dogs beforehand.
And one little thing about this, for years, people would come in and I would map the experience and say what it's going to be like, and draw all of my stuff as we were going, because I was short on time. But now I make sure that when they walk into the room, everything's ready, and I've got all of my material in it happens to be a youth bag. It could be a basket or a box, but everything in that you need to look prepared and not just go like, oh, just like a vaccine, No, everything's prepared. We were waiting for you. This is special. We're here to help. And also you can get that at a hotel, get the hanger that you put at the handle and say, do not disturb. And so yeah, just get one from Holiday Inn or Hilton, or make yours, it's very easy. And people are so moved by that you took the time to do that.
Yeah, I've seen clinics that will have the sign on the door, like a someone saying goodbye.
And keep those families together
to make sure nobody comes in
and keeping those families together during that service, from the whole service, instead of we're going to be taking him to the back or her to the back. No, help that team understand and feel comfortable in doing that service, the entire service, with that family present. That's important.
Yeah, and about this team, I feel that our teams are so big now, and the people have expectations, and I very much value your training that I took at CATA, Rebecca, and especially the intra-organ lab that I had the chance to take, to be able to, if I can't find a vein, and it happens sometimes, not that, but to be able to inject intrahepatic, intratumor, and now I do intrarenal as my main one for cats. I don't see why I would just be in their face and look for a cephalic vein or be in the bag. But yeah, that was very high. But I think that we all need euthanasia protocols for our clinics, because our teams are getting bigger and bigger, and to make sure no detail at all is left to whatever, because there's so many things to talk about.
Yeah, I think different techniques are definitely something that is a constant education on euthanasia practices. I think is so important. I mean, we always, we deal with CE with everything else, but it should be the same for the euthanasia process. There's different medical techniques that you can use, like as you said, and I've seen many of them used, and definitely have preferences for certain ones over others. But even if you're not well versed in those techniques, even evaluating which vein am I going to be working at, right? And kind of maximizing the ability for the pet parent to be able to interact with their pet, and taking that into consideration before you even start the procedure. Talk about positioning, talk about how would you like to be with your pet. Would you like to have them on your lap? Would you want to have them on the table? Do you want to be on the ground with them and on a blanket? What makes you more comfortable before you even get started?
Yeah, and for me, it was such a game changer to move from the cephalic veins to the lower to the back legs. Instead of being in their bubble, and then they can be in the front kissing their pet and crying and everything, and I'm in the back with my vet tech friend, and we're doing our business. But such a game changer, really stress release.
Yeah. Yeah. Well, thank you.
So, and then, by the way,
you, Celine,
about the training, your training is available online.
Yes.
Our training is available online because the teams are so big and everybody's working a different schedule. But at least if, as a practice, you can say, we'll take that many hours of training, so we're all on the same page for at least that piece of the experience. I think that's major.
Yeah. And that's what I was going to end with as well, is that there is beautiful training. Again, I'm a certified peaceful euthanasia professional. There's opportunities for certified peaceful euthanasia veterinarians, and then even for practices to be certified in this as well, so that there is this team approach, so that there's consistency in this delivery, because it's something that we need to do really well as a team.
Yeah, absolutely. I would encourage everyone to check out the resources that were posted via the QR codes, as well as the Euthabag and the CETA websites. We'll have like a little summary that we'll send out to everybody with all the takeaways, so that you'll have that. We'll also find that poem that Dr. Celine was referencing as well. I just wanted to say thank you so much, ladies, for taking the time out to have this conversation. It means a lot to me personally, and I hope that the people who tuned in to view got a lot out of it. And I think I admire both of you guys, and I want to thank you very much.
Yeah, thank you, and you're an amazing moderator. Not to say, I think you're totally in the top ones I've met. You're amazing.